Good morning, Natalie. Thank you for joining us today.
Good morning, Dr. Williams. Thank you for the opportunity. I'm excited to learn more about this role.
Let's begin with your background. Can you tell me about your experience as a registered nurse and what led you to pursue a career in clinical research?
Certainly. I've been working as a registered nurse in a hospital setting for the past 5 years, primarily in internal medicine and oncology. I've always been fascinated by the role that evidence-based practice plays in patient outcomes. Over time, I became more involved in research protocols within our unit, administering investigational drugs and collecting data for trials. That experience sparked my interest in contributing to research full-time.
What aspects of nursing do you believe will benefit you in this role?
As a nurse, I've developed strong patient communication skills, meticulous attention to detail, and the ability to manage multiple tasks in high-pressure environments. I also understand the clinical side of patient care, which helps when interpreting protocols and assessing adverse events. I believe these strengths will allow me to bridge the gap between patients, physicians, and sponsors.
Have you had any formal training or certifications in clinical research?
Yes, I recently completed an online clinical research coordinator certification course through ACRP, where I learned about GCP, IRB submissions, informed consent, and data management. I've also shadowed a CRC at my hospital and participated in 2 phase 2 trials in a support role.
Clinical research involves strict regulatory compliance. How comfortable are you with documentation and protocol adherence?
Extremely comfortable. In nursing, documentation is everything, and I take it very seriously. I'm used to charting in EMRs, following procedural checklists, and ensuring medication administration matches physician orders exactly. I approach protocols with the same rigor, always verifying, double-checking, and escalating if there's a discrepancy.
Can you describe a situation where you had to educate a patient about a complex or unfamiliar process?
Certainly. One instance that stands out was when I had to educate a newly diagnosed cancer patient about their upcoming chemotherapy regimen. It was overwhelming for them. I broke it down into simple, clear steps, used diagrams, and gave them written materials to review. I also involved their family and followed up the next day. I'd apply the same methodical approach to informed consent in a research setting.
Let's talk about collaboration. This role requires working with principal investigators, coordinators, patients, and sponsors. How do you manage cross-functional communication?
I always start by clarifying expectations and documenting communication when possible. I tailor my language based on the audience, whether I'm speaking to a patient, reporting data to a sponsor, or updating a PI. I also make sure to actively listen and follow up to keep the team aligned.
What tools or systems have you used that might be relevant in clinical research?
I've worked with Epic and Cerner for patient documentation and REDCap for research data entry. I'm also familiar with Microsoft Excel, Outlook, and document management platforms like OneDrive and SharePoint. I'm currently learning more about CTMS platforms like Metadata and Viva.
How do you handle deviations from protocol or potential adverse events?
First, I document the deviation immediately and notify the principal investigator. Then I report it according to protocol guidelines and SOPs, whether that's notifying the IRB or sponsor. I make sure to assess patient safety first, document everything clearly, and participate in root cause analysis if required.
Can you give me an example of a stressful or fast-paced situation you've handled and how you managed it?
During the height of the pandemic, we were short-staffed in the ICU, and I was overseeing 5 critical patients. I prioritized tasks, communicated constantly with physicians, and helped implement a color-coded system to identify the most urgent needs. It was intense, but it reinforced my ability to stay calm, adapt, and lead during pressure.
What excites you most about working in clinical research?
The opportunity to contribute to science in a way that improves patient care long-term. I love being part of something that goes beyond the bedside, helping validate new treatments, improve protocols, and ultimately advance medicine. It's a natural extension of my passion for patient advocacy.
How do you stay current with clinical research trends and best practices?
I subscribe to newsletters from ACRP and clinicaltrials.gov, attend webinars, and participate in nursing and research forums. I also follow trial publications in oncology and review FDA approvals to stay informed.
Do you see yourself working in a specific therapeutic area or type of trial long-term?
I'm particularly interested in oncology and immunotherapy trials, given my background, but I'm open to broadening my experience, especially in first-in-human or rare disease trials where the need for coordination is high.
What are your long-term career goals in this field?
I hope to become a senior clinical research coordinator or eventually move into project management. I'd also love to mentor nurses who want to transition into research, just as others have helped me.
Excellent. Do you have any questions for me?
Yes. How is your site structured in terms of study assignment, and what opportunities are there for professional development?
We typically assign studies based on therapeutic experience and availability. As for development, we support continuing education and often promote internally into lead coordinator or project roles.
That's fantastic to hear. I'm eager to contribute and grow within a team that values both science and support.
Thank you, Natalie. It's been a pleasure speaking with you.
Thank you so much for your time, Dr. Williams. I look forward to the next steps.
If you found this video helpful, don't forget to subscribe, give it a thumbs up, and share your thoughts in the comments below. Your support means a lot.